Why do some seniors receive medications they don't actually need, while others have serious health conditions overlooked entirely, all because of a simple morning routine? What if the way you prepare for your blood test matters just as much as the test itself? And small, seemingly harmless habits could be quietly sabotaging your results? Your blood tells a story about what's happening inside your body, revealing conditions you can't see or feel, but that profoundly affect your well-being. However, that story can be completely rewritten by what you eat, drink, do, and even how you feel in the 12 hours before your test. Every choice you make that morning sends ripples through your bloodstream, altering the delicate balance of glucose, cholesterol, enzymes, and hormones that your doctor depends on to make critical decisions about your care. Today, we're going to examine 5 critical mistakes that countless seniors make before blood tests, mistakes that can transform routine screening into a source of unnecessary worry, incorrect diagnoses, and misguided treatments. More importantly, I'll explain exactly why these habits matter and what you should do instead. Let's begin with the first mistake: eating or drinking anything other than water before your blood test. When you consume food or beverages other than plain water, your body immediately launches into complex chemical reactions that fundamentally change what's flowing through your veins. Carbohydrates break down into glucose, causing blood sugar to rise. Your pancreas releases insulin. Fats enter your bloodstream as triglycerides. Your liver starts processing nutrients, changing enzyme levels. All of these shifts happen quickly and dramatically. Consider a simple breakfast of toast with butter and orange juice before your test. Within 30 to 60 minutes, your glucose levels can spike significantly above your true baseline. Your triglyceride levels might double or triple. Even cholesterol readings can be affected. When your doctor reviews these elevated numbers without knowing about your breakfast, they see potential diabetes or cardiovascular disease. They might prescribe unnecessary medications or order additional invasive testing based entirely on results that don't represent your actual health. Many people assume black coffee must be acceptable because it contains no calories. Unfortunately, coffee contains caffeine, a powerful stimulant that triggers measurable metabolic changes. Caffeine prompts your body to release cortisol, your primary stress hormone. It stimulates your central nervous system, temporarily raising blood pressure and heart rate. It influences how your liver processes substances, altering enzyme levels doctors use to assess liver health. The only truly safe beverage before a fasting blood test is plain water, and you should drink plenty of it. Staying hydrated is important because dehydration concentrates certain substances in your bloodstream while diluting others. Water helps maintain normal blood volume and makes the blood draw easier by keeping your veins properly filled. The standard fasting period is 8 to 12 hours. If your test is scheduled for 8 in the morning, your last meal should be no later than 8 the previous evening. From that point until your blood is drawn, only water should pass your lips. The second critical mistake involves taking your morning medications and supplements as usual. Many common medications that seniors take daily can temporarily alter blood test values or interfere with laboratory equipment. If you take cholesterol-lowering medications like statins, taking your pill right before a lipid panel can show artificially lowered cholesterol levels. Your doctor needs to see what your cholesterol looks like on your medication regimen over time, not what happens 1 hour after swallowing a dose. Thyroid medications like levothyroxine can temporarily spike hormone levels in your blood, making dosage appear too high when it might be perfectly appropriate. Blood thinners like aspirin or warfarin affect clotting factors. Diuretics change electrolyte concentration and can affect kidney function tests. Biotin, found in many multivitamins and hair, skin, nail supplements, deserves special mention. Biotin interferes with certain laboratory tests in ways that produce drastically incorrect results, particularly affecting thyroid function tests and cardiac markers. Herbal supplements containing ginseng, ginkgo biloba, or St. John's wort can affect liver enzymes, blood sugar levels, and blood clotting factors. The safest approach is to delay taking your morning medications and supplements until after your blood is drawn. For most medications, waiting a few extra hours won't cause problems. However, if you take medications for serious conditions like heart disease, seizures, or severe high blood pressure, talk with your doctor ahead of time about whether it's safe to delay your dose. Here's a practical tip. On test morning, gather all your medications in a small bag and bring them to the laboratory. Take them immediately after your blood is drawn, maintaining your regular schedule with only a brief delay. The third mistake is engaging in physical activity before your blood test. Any physical exertion can significantly alter your blood chemistry in misleading ways. During activity, your muscles consume glucose for energy, temporarily lowering blood sugar. Simultaneously, stress hormones trigger your liver to release stored glucose, which can raise blood sugar. The unpredictable fluctuations make accurate measurement nearly impossible. Your muscles produce lactic acid during activity, and elevated levels can be misinterpreted as signs of serious conditions like tissue damage or oxygen deprivation. Exercise increases metabolic rate, affecting how your liver processes substances and potentially raising liver enzyme levels. Your cholesterol and triglyceride levels can be temporarily altered. Even your white blood cell count increases after exercise, which might be mistaken for infection or inflammation. Think about what many seniors do on test morning without realizing the impact. Perhaps you walk briskly across the parking lot, take stairs instead of the elevator, do your usual stretching routine, or walk your dog. On any other day, these are healthy activities. But on blood test day, they're introducing variables that skew your results. The solution is straightforward. On test morning, your goal is to present your body in its most neutral, resting state. Don't perform your usual exercise routine. Don't rush around getting ready or doing household chores. Park close to the laboratory entrance. Take the elevator. Move slowly and deliberately. The fourth mistake is consuming alcohol or using tobacco products in the day leading up to your test. Both substances have profound, lasting effects on blood chemistry that persist for 24 hours or longer. When you consume alcohol, your liver immediately begins metabolizing it, creating byproducts measurable in your blood for many hours. Alcohol consumption raises triglyceride levels substantially. A glass or two of wine the night before can elevate triglycerides enough to suggest a lipid disorder when your actual baseline is completely normal. Alcohol affects liver enzymes, and elevation can indicate liver damage or disease. It disrupts blood sugar regulation, sometimes causing dangerous drops. It impacts kidney function and alters electrolyte balance. Alcohol causes dehydration, which concentrates certain substances while making others appear lower than they are. Even one drink can cause measurable changes that persist into the next day. For accurate results, completely avoid alcohol for at least 24 hours before your test. If blood work is scheduled for Monday morning, no drinking on Sunday. If your test is Thursday, skip Wednesday's wine. When you smoke a cigarette, nicotine and hundreds of other chemicals immediately enter your bloodstream. Nicotine raises heart rate and blood pressure. It causes blood vessels to constrict, reducing blood flow, and affecting how efficiently blood carries oxygen. This can trigger increased red blood cell production, raising counts in ways that can be misinterpreted as blood disorders. Smoking raises white blood cell count as part of inflammatory response. It increases cortisol levels, affecting blood sugar regulation. It impacts cholesterol profile, typically lowering beneficial HDL while raising harmful LDL. Carbon monoxide binds to red blood cells in place of oxygen, suggesting respiratory or cardiovascular problems. For accurate results, avoid smoking for at least 24 hours before your test. I recognize abstaining can feel challenging, but remember, you're not wasting the test and potentially setting yourself up for incorrect medical decisions. The temporary sacrifice is worth obtaining reliable results. The fifth mistake is arriving at your test stressed, rushed, or sleep-deprived. Your emotional and physical state at the moment of blood draw has direct, measurable impact on blood chemistry. When you experience stress from running late, worrying about results, dealing with traffic, or struggling to find parking, your body releases cortisol and adrenaline. These stress hormones create a cascade of changes. Heart rate and blood pressure rise. Your liver releases stored glucose, raising blood sugar significantly. Your immune system increases white blood cell production. Stress hormones affect cholesterol levels and raise inflammation markers. Imagine this common scenario. You wake late, rush through your morning, hurry through traffic, worry about being late, struggle to find parking, and rush into the building out of breath with your heart pounding. The blood drawn at that moment doesn't reflect your normal state. It reflects acute stress. Your cortisol and adrenaline are flooding your system. Blood sugar is elevated. Blood pressure is higher. White blood cell count shows elevation. Poor sleep creates similar problems. Sleep deprivation produces excess cortisol. Blood sugar regulation becomes impaired. Inflammatory markers increase. Blood pressure runs higher than normal. The solution requires both practical preparation and mental awareness. Get a good night's rest before your test. Go to bed earlier than usual. Create a calming bedroom environment. Avoid stimulating activities before bed. On test morning, give yourself substantially more time than needed. Set your alarm 30 minutes earlier. Move at a calm, deliberate pace. Plan your route the night before, adding significant buffer time. Arrive at least 15 to 20 minutes early. This eliminates stress about being late, gives time to find parking, and provides a window to sit quietly and let your body settle. Use those minutes intentionally. Close your eyes. Focus on slow, deep breathing. This activates your parasympathetic nervous system, which counteracts stress and lowers cortisol levels. If you experience significant anxiety about blood draws, let the staff know when you check in. They're experienced with anxious patients and can often make the processes easier. If anxiety is severe, talk with your doctor well before your test. Sometimes physicians can prescribe mild anti-anxiety medication to take an hour before your appointment. Blood tests are among the most important diagnostic tools for monitoring health, diagnosing developing conditions, and adjusting treatments. For seniors, these tests help manage chronic conditions like diabetes, heart disease, thyroid disorders, and kidney disease. They monitor how medications are working. They catch warning signs early. But all of this depends entirely on accuracy. When results are distorted by these 5 mistakes, you're giving your doctor false information. You might be prescribed unnecessary medications with their side effects and costs. Existing medications might be adjusted incorrectly. You might undergo additional expensive, invasive testing. On the other side, distorted results can mask real problems that need attention. Here's your action plan. When you schedule your appointment, mark it clearly on your calendar with preparation notes. The evening before, eat a normal dinner, but finish at least 12 hours before your appointment. Avoid alcohol that entire day. If you smoke, avoid tobacco for 24 hours. Set out water as a reminder. Prepare medications in a bag to bring with you. Set your alarm for extra time. On test day, move slowly and calmly. Don't exercise, rush, or do housework. Drink only water. Wear comfortable clothing with sleeves that roll up easily. Leave with substantial buffer time. When you arrive, check in, then sit quietly. Practice deep breathing and relaxation. After your blood is drawn, take your medications immediately and have a nutritious breakfast. If you have any uncertainty about preparation, call your doctor's office or the laboratory ahead of time. Medical professionals prefer to answer questions before the test rather than deal with inaccurate results afterward. These aren't arbitrary rules. These are evidence-based guidelines that exist for one crucial reason: to help you get the most accurate, meaningful results so you receive the best possible medical care. Every small step you take to prepare properly is a direct investment in your health and future quality of life. By following these 5 essential guidelines, you're ensuring the clearest, most accurate view of your actual health status, which translates to better medical decisions, more appropriate treatments, and ultimately, better health outcomes. Take control of your blood test preparation, starting with your very next scheduled test. Share this information with others who undergo regular blood work. Subscribe for more practical health guidance designed for seniors. Leave a comment sharing your experiences or questions. Remember, accurate blood work leads to accurate diagnoses, which leads to effective, appropriate treatment. You deserve the best possible health care, and it starts with proper preparation for your blood test. Here's to your health, to clarity in your medical care, and to your empowerment in managing your well-being at every stage of life.